When vaccinating infants and children, it is important to keep the child still and make sure that both you and the caregiver are comfortable. Positioning the child correctly allows you to vaccinate efficiently. It also helps minimize unexpected motion and needlestick injuries. There are 5 recommended positions for vaccination. The choice of position will depend on the number of vaccines to be given, the age of the child, and the materials available. The first 3 are for infants, the 4th is for children aged 12 months or older, and the 5th is for adolescents and adults. Let us examine each position and the advantages and disadvantages of each one. In the cuddle position, the infant is lying sideways at a 45-degree angle on the caregiver's lap. The caregiver hugs the infant's shoulders and upper body close to her body. With her other arm, she holds the infant's legs. The advantages of the cuddle position are that the infant's arms and legs are securely held by the caregiver, and the infant is comforted by close contact. In addition, leg and arm injections are possible without changing positions. The disadvantages are that there could be a delay between injections if 2 intramuscular injections are given, since they would need to be delivered in different thighs. And it can be difficult to restrain an infant after switching sides. It is best to avoid this position if 2 intramuscular injections must be given. In the bed position, the infant lies on a flat surface with both legs bare. The caregiver stands on the side of the bed and holds the infant's arms. To give an injection, stand at the infant's feet. Make sure the infant's leg to receive the vaccine is slightly bent. Use one hand to gently cup the infant's knee. The advantages of this position are that the infant's arms are held securely by the caregiver and the infant is comforted by eye contact. Also, it is possible to give an injection in both legs without changing the infant's position. The disadvantage is that you will be responsible for restraining the infant's legs. The upright position is when the infant is sitting upright on the caregiver's lap, facing out. The caregiver rests the infant's back against her chest. She hugs the infant's upper body and arms with one arm and uses the other arm or her knees to hold the infant's legs. When you give the injection, stand at the level where it can be given at a 90-degree angle. One advantage of this position is that the infant's arms and legs are held securely by the caregiver. Another is that multiple injections are possible without changing positions. A disadvantage is that the caregiver is responsible for restraining the infant's legs, and the infant has no eye contact with the caregiver. For children older than 12 months, you can use the straddle position. In this position, the child sits upright on the caregiver's lap, facing her, with legs straddling her body. The caregiver hugs the child's upper body. The advantages of this position are that the child's arms are tucked securely under the caregiver's arms, the child is comforted by close contact, and multiple injections are possible without changing position. A disadvantage is that the child's thigh muscles may be tense, and unless the caregiver helps, you will be responsible for restraining the child's leg. For adolescents and adults, use the independent position. In this position, they can be vaccinated in the upper arm while sitting upright. The advantage is that you have good access to the deltoid. The disadvantage is that any restraint depends on you as the vaccinator. Regardless of which position you choose, remember to reassure the caregiver and child with a soft voice, explain the steps, and provide privacy. Now you know different positions for vaccinating infants and children.